In this video, we're going to talk about skin safety and preservation. On its most basic level, climbing and skin are kind of at odds with each other. So we want to just be very proactive in our care for skin. So the three things that we kind of look for are pressure sores, friction like abrasion, and then pressure points that we're causing pain or skin degradation and breakdown. What we do is treat those kind of the same across the board. So pressure sores can happen within 5 minutes. So people in wheelchairs, paraplegics, quadriplegics, we're very aware if they're bumping into things or leaning on things, because once they get into that harness, we're putting pressure where it shouldn't be. So we want to always be paying attention to what's pushing and how hard it's pushing. And the way we kind of stay ahead of that is when they come down, we kind of do one route, bring them back down, and then we take a break. So we offload those pressure points. So either that means going back into their wheelchair or just going into a comfortable sitting position. The other is friction from the harnesses and the ropes. So the friction is always being pulled up. So that means the harness is pulling up and pulling on the skin. So we can get kind of tears, we can get friction burns, things like that. Again, it sounds very simple, but we just bring them down, release that pressure by sitting, laying, whatever it is to get them comfortable and offload that pressure. And then we also have abrasion and wear from the wall or from the actual rocks outside. So that's kind of one of the hard stop areas where if the person kind of bangs and we see blood, that's a stop right away. We bring them down, we clean the wound, we cover the wound. If it's not real bad, we can kind of keep climbing. But again, if it's something that's kind of deeper and needs more care, that person's probably going to have to take care of that on their own and remove them from that community event. Mostly the skin is always being checked on, always staying hydrated, and always just trying to stay ahead of those things by inspection.